So today's topic is recent trends in the prevention and diagnosis of dental caries. As we all know, that a lot of work has been done in this field by the researchers for the development of the means of diagnosis of dental caries as well as early diagnosis of dental caries. They may range from very simple ones to highly sophisticated ones. Now, what is the main target for the prevention of dental caries? That the agents which target particular bacteria or the bacteria which are producing acids for the degradation of the enamel and demineralization of the tooth. So first they do that the preventing agents either target the colonization of the bacteria on the tooth surface, that is they prevent the colonization of the bacteria on the tooth surface, or second they inhibit the production of the acids which causes the demineralization of the tooth, or either they help in modification of the diet, or they may also target in preventing the adhesion of the bacteria to the tooth surface, so the bacteria cannot produce any acids and demineralize the tooth surface. So these are the main target points of the preventive agents which are used in caries. A lot of upcoming recent preventive agents have come across. They are, first of all, we come across pit and fissure sealant. Now, what are the pit and fissure sealants? Basically, the pit and fissure sealants lock the doors for the house of the bacteria. Basically, the pit and fissures are deep grooves on the tooth surface and they serve as a habitat for the bacteria to adhere to the tooth surface and grow freely. So if we apply the pit and fissure sealant to the tooth, they prevent further colonization or attachment of the bacteria to the tooth surface and the harbor of the bacteria is stopped. So this is the function of the pit and fissure sealant. Next comes the use of the food factors like use of phosphate or season in food. Season is often found in cheese. It inhibits the production of the acids by the bacteria and adherence of the bacteria to the tooth surface. So basically, season will prevent the causative agent of dental caries to cause demineralization of the tooth surface. So season is usually found in cheese or milk product, which can be used as a preventive agent. Now next comes the phosphate, which are present in certain other food products, and they are also present in dentifrices. They prevent in neutralizing of the acids which are produced by the bacteria and further prevent the mean demineralization of the tooth surface. They are also present in chewing gums and other cereals and other food additives. Then comes the artificial sweeteners. Now what are the artificial sweeteners? They are basically either synthetic or naturally derived. They may be either calorific or non-calorific, that is either producing any energy or without producing any energy. They are basically used as a substitute for the sugar in the diet as a sweetening agent. For example, the sorbitol, xylitol, and amaltase, lactase, etc. Now comes another recent anti-caries agent or caries preventive agent is the dicalcium phosphate, which is present in the chewing gums. These dicalcium phosphate prevent the colonization of the bacteria and preventing dental caries. Similarly, amorphous calcium phosphate is found in dental mousse or other dental agents. Now we can apply the amorphous calcium phosphate to the tooth surface and they help in filling up the crevices of the tooth and the remineralization of these crevices and further prevent any demineralization of the tooth surface. So this was the role of the amorphous calcium phosphate, which is present in certain dental agents or dentifrices recently. And lasers is another preventive agent for caries, like carbon dioxide laser. Argon laser can be used as a caries preventive agent. Now, one of the most recent upcoming branch for the prevention of dental caries is the use of caries vaccine. We'll be discussing it about later on. Now, what are the sugar substitutes? The sugar substitute can either be non-calorific or calorific. So, the calorific sugar substitute, they basically supply with more calories, and non-calorific substitutes are used in the case of obesity or in the case of diet planning. Such non-calorific sweeteners are yielding little or no energy at all, and they are saccharin, then cyclamates, aspartamates are also present. And these are the substitute of the either naturally occurring sugar, and they are either natural or synthetic and derivatives. They taste much sweeter than sugar. Then comes the calorific sugar substitute. They are basically xylitol, mannitol. They are found in chewing gums as an additive. They are also advocating anti-caries level in any caries prone patient or caries prone person. So if the person, in such cases, such chewing gums are prescribed, which can be frequently taken up by the patient who is more caries prone for the prevention of the caries. They prevent the adhesion of the bacteria to the tooth surface. And sorbitol is another naturally occurring sugar, but it is less sweeter than that of sucrose. Sucrose is one of the most reducing sugar which is present in diet, and if it is substituted by such artificial sweeteners, the caries level may fall or decline, and they are more used in caries prone individuals as we have already discussed. They can also be added to dentifrices for the sweetness purpose, and they do not aid in any caries producing activity too. Then comes saccharin. Saccharin has the sweetness of almost 200 times than that of the sugar. It is basically found as an additive in ice creams, in chocolates, in candies, and in other sugared syrups, so that it may prevent the causation of dental caries also, and it may produce a beneficial effect of sweetening or energy levels. Now, what is caries vaccine? Caries vaccine was discovered in order to prevent the level of the rising of the dental caries in individuals. A caries vaccine is basically a suspension of attenuated microorganisms, that is, the organisms which have a decreased level of activity, and they are in suspension form for the amelioration, the prevention, and the treatment of dental caries. Now, what is the concept behind dental caries vaccine? The main concept of dental caries vaccine is it activates the immunity, active or passive immunity of the individuals, and thereby produces T and B lymphocytes. This T and B lymphocytes harbor as secondary immunity or memory cells in the humor of the humans, and in the blood of the humans, and in other hormonal levels. They act independently, and as the dental caries agents attack, these T cells and B cells come into activity and prevent the further progression of the dental caries. They prevent the metabolism of the bacteria and production of acids by the bacteria. They also prevent the formation of glucans, which help in adherence of the bacteria to the tooth surface and prevent the microorganisms from colonization in the tooth surface. There are various routes of administration of this caries vaccine. This may be either oral or systemic, active or passive, or through the gingival circular fluid. So this caries vaccine has a lot of beneficial effects, and studies are still going on the progression of and the activation of such type of vaccine. The main advantages of caries vaccine is that it can be given in the young individuals, in children, along with the other vaccines of diphtheria, tetanus, etc. Secondly, the main advantage is that it is Streptococcus mutans is the main causative agent, and it can be given at the time of 6 months or so on, along with the diphtheria toxin, etc. The limitation of the vaccine is that Streptococcus mutans is not the only agent for causing of dental caries, but the caries vaccine has been formulated according to the resistance of Streptococcus mutans, so it will not act on other bacteria. Similarly, the immune system must respond to the bacteria on daily basis since the colonization of the Streptococcus mutans is right from the first eruption of the tooth in the oral cavity, that is from the 6 months itself. Now, the other means of this caries prevention has also developed. These agents are like lasers. Lasers will help in the prevention of dental caries, like argon laser, carbon dioxide laser, then xylitol and mannitol. The caries preventing chewing gums are present, etc. There is another upcoming branch of prevention of dental caries is by replacement therapy. Is that we replace the Streptococcus mutans bacteria by another mutant bacteria, that is Streptococci, or that is again replaced by another genus of Streptococci, that is Streptococcus guadini, and thus we prevent the colonization of Streptococcus mutans on the oral cavity surfaces. There's another polyfluoride systems are present which help by the action of fluoride in the prevention of caries. Then 4% sodium fluoride system is used. Then APF gel along with the fluoride systems and along with amorphous calcium phosphate is used to prevent the dental caries. Now we come to the diagnosis of the dental caries. Now what is basically the diagnosis? That is, at early stage of dental caries or incipient caries are detected easily by these recent diagnostic methods. They can be either the visual examination by the means of the mouth mirror or the probe, then by a blunt probe or a blunt mouth mirror. Then we can also diagnose them by the means of radiographic methods, that is by bite wing radiographs or intraoral periapical radiographs and occlusal radiograph. But the drawback of the radiograph is only after 20 to 25% demineralization, a radiograph will catch or will manifest the appearance of the dental caries. Incipient dental caries are not visible on the dental radiograph. And in the case of a blunt probe, we can detect plaque from the tooth surfaces. Sometimes even the catch of the probe is considered to be a false positive test for the dental caries. Now the recent methods for the prevention and for the diagnosis of dental caries have developed, and in the diagnosis section the recent methods are fiber optic transillumination, then that is photi or diphoti, then fluorescence methods, electric conduction methods, magnetic resonance imaging, and so on. So we'll discuss each of them individually. Now what is electric conductance measurement? In this basically what happens, the conductance or the electric conductance of the demineralized tooth or the carious tooth is lesser than that of the normal tooth, which can be detected on numerical monitor. So if we place an electrode or the probe on the tooth surface and the conductance is impeded to a level in the carious tooth, this will be recorded on the digital monitor and we can easily administer that whether the tooth is carious or not. Then comes direct digital radiography, that is directly we can capture the radiographic image of the carious tooth which will be deflected on the monitor. Then the other advanced diagnostic methods are photi, that is fiber optic transillumination. Then what it is based on the principle that the transmission or the transmission index of the tooth which is carious is lesser than that of the tooth which is non-carious. So in fiber optic transillumination, and is it digitally, if it is digitally involved, then we name it as digitally involved or digital fiber optic transillumination. In that the difference in the conductance from the carious tooth is recorded on another monitoring device and it will show up on the monitor. So next comes the laser fluorescence. In the laser fluorescence, it is basically a laser active device, and by the means of fluorescence of the defective tooth surface or the caries tooth surface, this difference in the fluorescence is recorded. First, basically the diagnodent works on this basic principle. It is a battery operated device. It is a diode laser device. In this, first we take the probe, or the digital fiber optic probe is placed on the tooth surface, and again the fluorescence which is detected from the caries tooth surface is taken up by another probe, or the fiber optic probe, and then this probe further transmits it to the monitor, which will record the difference in the fluorescence between the sound enamel and the caries enamel. The basic advantages of this diagnodent: it is very simple instrument and simple to use, and provides a quantitative measurement of the caries tooth surface. So the level of the caries can also be detected by the diagnodent. The level of caries is so that it ranges from 0 to 40. So if it is 0 to 20, then the tooth is sound. If it is from 13 to 20, then the tooth is enamel caries is present. If from 20 to 30, dentinal caries is 30, greater than 30 it is there, then the caries of the pulp is present, or pulp degeneration has taken place. But the basic disadvantages of this method is that it cannot differentiate between the sound enamel or any defects in the enamel, like defects of amelogenesis imperfecta, dentinogenesis imperfecta. It can also not detect any secondary caries or recurrent caries around another restoration. So the accuracy level of the diagnodent is less. Even if there is a presence of a restoration and above the dental caries, if it is there, then the diagnodent cannot detect that caries level. Similarly, certain caries detector dyes like silver nitrate, methyl red, alizarin stain can detect the difference between the affected and the affected dentine. That is, the dentine which is infected by the bacteria and the dentine which is not infected by the bacteria. Similarly, zero radiography is a modified radiographic technique in which we can easily obtain the Xerox copies of the images of the tooth surface. Then ultrasound. Ultrasound is a sonic device, that is, the speed or the velocity of the sound is different in enamel, dentine and cementum and caries tooth. So if the caries, in the case of caries tooth, the speed is less, this can be recorded by the ultrasound device. Then various endoscopic measures are present which measures the fluorescence which are emitted by the infrared light. Then magnetic resonance imaging, it records difference of the energy levels of the various spins of the electrons across the infected tooth surface. Then comes the optical coherence tomography and other recent caries detection methods which detect the sections of caries or various sections of tooth for the presence of caries. They can also help in detecting the depth of the dentinal caries. So all of them I have described the basic methods for the prevention of the tooth caries and the recent methods of the diagnosis of the dental caries. Thank you.